Namaste, all of you. And in this video, I will be discussing very briefly to trigger the thoughts on promising subspecialty in psychiatry. I am Dr. N. Manjunatha, working as additional professor of psychiatry at Newman's, Bangalore. Yeah, this is the 10 subspecialty in psychiatry which has a promising future in next few years to decade. First one is interventional psychiatry. It is already on the way. It is to do with some physical maneuver during the treatment aspect like ECT, RTMS, TDCS, those kind of things. Second one is intensive care or critical care psychiatry. Often psychiatrists think that, psychiatry doesn't have a role in ICU. There are a lot of role in psychiatry, especially intensive care specialists would look towards psychiatrists for managing these patients and family members in the ICU. And if you see 30 to 40% of the patients in ICU in general hospital are in delirium for one or other reasons. And psychiatrists can change the treatment outcome of these patients better than other specialties. So I believe this is one untapped potential among the psychiatrists, especially in private psychiatry. Coming to third, peri-operative psychiatry, it is a self-explanatory. It is psychiatric help during pre, during and post surgery is needed in especially in the general hospital psychiatry for various reasons. Coming to cosmetic psychiatry, it is also self-explanatory, especially in cosmetic surgery. Plastic surgeon or a dermatologist will look towards the psychiatrist for the help, especially for the psychiatrist opinion for the surgeries. Coming to fifth, sports psychiatry, it is a huge untapped potential, especially in coming a decade, especially in our country like India. And coming to sixth, palliative care psychiatry, it is beyond rehabilitation psychiatry. I would think this psychiatry is to deal with treatment resistant schizophrenia or difficult to treat psychiatric illness, especially with end life illnesses and chronic physical illnesses. Coming to transplant psychiatry, it is also self-explanatory, especially law in India, where mandatory requirement for mental status of the people who are giving the transplant and who are a recipient of the transplant is badly needed. But the law doesn't say psychiatrist is needed for mental status of the people, but they say doctors. But if psychiatrists become proactive, that these law can be tweaked to make it psychiatrist's opinion. Coming to public psychiatry, this is beyond community psychiatry. We have published paper on what is the difference between community psychiatry and public psychiatry. Public psychiatry deals mainly with a non-clinical aspect of the psychiatry where public education, policy making, those kind of things. Coming to wellness psychiatry, this is one of the area which is still in infant stage. As of now, we can define these subspecialty like deals with the psychiatric patient who has recovered from the psychiatry and working towards wellness. Then coming 10th, distress psychiatry is an untapped huge potential among the people who seek psychiatrist help but they don't have psychiatric disorder, but they are in a kind of stress or distress for various reasons, academic stress, financial stress, interpersonal stress, those kind of things need of our. What is needed for this subspecialty to grow? Proactiveness from psychiatrists is the need of the hour on this area to prove their worth in bringing the best outcome of the patient. Once you bring best out of a patient compared to other specialty, definitely you are in a better edge. Department of Psychiatric Academic Institute need to be more active and encourage young faculty and residents to do work on these areas. And even in private practice of psychiatry, many private psychiatrists can do miracle things immediately in these three areas: interventional psychiatry, intensive care psychiatry, and distress psychiatry. This is a step towards psychiatry as a mainstream medical specialty. Please like, share, subscribe for these kind of brainstorming videos. Also feel free to give comments in the comment section. Importantly, think about it and if convinced, practice it. Dhanyavada.